see. What is the most likely diagnosis in this patient? So, a 30-year-old woman falls from a height of 15 feet and suffers severe traumatic brain injury. She is unconscious and with a Glasgow Coma scale of 5. The MRI reveals diffuse white matter, abnormalities with a focus on the corpus callosum, periventricular matter, and brain stem. Which of the following is the most likely diagnosis? What I think this is that it's just a concussion. It's not any of the hematomas for sure. Diffuse axonal injury, no. Cerebral contusion could be.
So let's work together with this one, okay?
Okay.
If you have a concussion, are you going to be unconscious?
No, you're
No.
gonna be
So
confused.
yeah, so it's likely not a concussion, right?
No.
Concussion is like a very, you get hit in the head, you get a little bit confused, but you're not like unconscious for a long period of time, right? And when it says
Mm-hmm.
that GCS score of 5, is that good or bad?
Bad.
That's like very, very bad, right? So
Yeah.
you have to know that this is probably very, very severe, right? And then when you
Mm-hmm.
get an MRI, it shows diffuse white matter abnormalities with the focus on the corpus callosum, preventricular white matter, and brainstem. So if it was an epidural hematoma of subdural hematoma, would you see that?
No.
No. Okay, so it can't be that on because it doesn't show
No.
it, right? So now you get between contusion and diffuse axonal injury. What does diffuse axonal injury mean?
What I had in mind, accidental injury, I thought it was the injury of the spine. I don't
No.
know
So,
if I no.
so diffuse axonal injury is going to be when your white matter and gray matter of your brain mix because the head trauma is so bad.
Okay.
A cerebral contusion is like you have a bruise on your brain. So which one do you think fits this picture better?
The diffuse accidental injury.
Okay. Does it make sense? And the way they're
Yeah.
going to describe it is that they're going to call white matter abnormalities that are diffuse, right? Meaning that there's mixing of gray and white matter. Practically, like your brain has become like scrambled eggs. When you mix the white yolk and the white, you get what I'm saying?
Mm-hmm.
So that means it's
Yeah.
really, really bad. You know what I mean? So a brain contusion, right, is usually you have some, localized neurologic deficits, but you're not going to have issues with the white matter, right? Concussion, right? You can get confusion, a little bit of loss of consciousness, but not much, and you should be able to be okay. You're not going to be a GCS of 5, right? Which is like you
Yeah.
need to be intubated, right? Because you can't protect your airway. Epidural and subdural hematoma. Epidural hematoma, right? You're going to see between the dura mater and the skull, so on the very outside, right? Subdural is
Mm-hmm.
underneath the dura, right? But you'll be able
Yeah.
to see this. Subdural hematomas is usually by older folk, right? Because you tear the bridging veins. Epidural hematoma, right? Usually you accidentally hit the terion side of your skull, or kind of where your middle meningeal artery is, and it causes a rush of blood that kind of fills up in that area, or the epidural space. Okay, so this is why the best answer here is going to be diffuse axonal injury, mainly because you see all this white matter destruction. Okay.
Mm-hmm.